Joining me now is obstetrician gynecologist Dr. Diane Long. Dr. Long, thanks so much for joining us.
Thank you.
Other than birth control pills, tell us about some of the new contraception.
Well, we have some improvements on the birth control pill. A couple of those are, one is a birth control patch and another is a birth control ring. The birth control patch is applied to the patient's skin and she changes that once a week for 3 weeks out of the month. The birth control ring is something that's actually placed vaginally and left in place for 3 weeks, then removed for her to have a period and then replaced again in a week. And they work in a similar way to birth control pills, so have many of the advantages of oral contraceptives, but more ease of administration for some women.
Does taking birth control pills for a long period of time, or other contraception for that matter, for a long period of time, make it harder for a woman to get pregnant?
If a woman does not have any ovulatory problems or fertility problems prior to using birth control pills, then the use of birth control pills will not interfere with her desire to become pregnant later on. As a matter of fact, birth control pills have that great advantage of being rapidly reversible in terms of ovulatory function. So a woman can take birth control pills 5 months or 6 years and not interfere with her ultimate fertility.
How do you decide what's best for you?
Well, first of all, talk about that with your health care provider who will know your past medical history, who can decide whether or not, for instance, birth control pills are a reasonable option for you, because birth control pills have a lot of contraceptive and non-contraceptive benefits. Then, it's really a patient decision based on the information that she receives when she discusses that with her gynecologist or other health care provider.
Dr. Long, thanks so much for joining us.